Hi, what's up everybody? My name is Dr. Muhammad, aka The Tooth Guy, and I'm here back for another video. And in the last video, I talked about what is a dental cavity. In today's video, what I'm going to be talking with you guys about is what is a dental filling. So how do we fill the cavity? What is it? What are we filling it with? And things of that nature. So without any further ado, let's keep going. So let's first start off with a definition. You know how we like definitions here. We already defined what a cavity is. So now we're going to define what a filling is. So when we're using the term filling, again, let's go back to Oxford. Filling, just a quantity of material that fills in or uses something to fill in something. It really is quite self-explanatory to the word. We're filling a hole that is created by that cavity. And in filling in that hole, there are many different materials that we can use to do so. Okay, now, so we can talk about a whole host of them, but for brevity, we'll just talk about the two main common types of fillings that you guys will see and most people are concerned about. These are amalgam fillings and composite fillings. So the thing about an amalgam filling, when you're thinking about an amalgam filling, I want you to think silver fillings. These are more old school type of fillings, but they're still pretty useful today. They're mainly metal. They look silver, but sometimes they'll start to rust a little bit and start creating that black appearance that people will see in the back and start thinking they have a black tooth. A composite filling is this tooth colored kind of clay type of material that the dentist will fill your tooth in and make it harden with that little blue light that you'll constantly see them shine in as they're crafting. These are much more common today. The main reason they're much more common today is for obvious reasons, that they look a lot better to people. Simple. Another reason why a lot of people prefer these composite fillings over top of these amalgam fillings is for another reason, and it's because of this mercury scare. So in order to understand the mercury scare, let's first understand the components of an amalgam filling. So amalgam fillings are made up of many different metals. That's what amalgam, the term amalgam just means like a mixture, a combination of. You can think of an amalgamation of two things. When people use that term, they're talking about you're mixing things together. So why we use the term amalgam and not just a metal filling is because it's not a particular metal. It is a metal which is made combining a few different metals, and there are different ones involved. There's zinc, silver, copper, etc. And different amalgams sometimes contain different mixtures, but the main reason why people initially went away from amalgam fillings is because of this mercury containing compound. And this mercury containing compound is actually an inactive form of mercury, but mercury in and of itself is a neurotoxin. So because of mercury's toxic material, a lot of people decided they didn't want to use amalgam. What they did not realize is the amount of mercury that is or is not in the amalgam filling, and or the type of mercury that is contained in this type of amalgam filling. Now, to not bore people with the science, the main issue is that there's a very tiny amount of mercury in there, sometimes less than certain fish. Okay, so people may think a metal filling a mercury bad. Why would anyone want that? Is maybe it was just an old thing? Is this just something that is a relic, so to speak? Are there any actual advantages of this filling? Well, yes, there are still advantages of this filling, which is why till this day there are dentists around the country and around the world who still offer these type of fillings. And so one of the main advantages of this type of filling is it's simply a stronger material. It is a metal. It is harder to break if you were to bite on it or something like that. Sometimes that comes with a little bit more rigidity, which is negative, which we'll talk about, but the main thing is the metal. It's stronger. Second thing is, it is bacterial static. So in this metallic environment created by this amalgam filling, it is very hard for bacteria to grow under these amalgams. It can still happen. It's just a lot harder than in the environment of a composite filling. Bacteria like the grainy nature of composite fillings better, and they don't have that same principle. So those are some positives about amalgam fillings. What are some negatives outside of the scare of mercury and the aesthetics? Well, one of the main downsides of amalgam fillings that are not psychological or just ugly, as the filling starts to conduct heat over time, that's going to happen in the thermal environment known as the mouth. Sometimes with really big versions of these fillings will start to expand and actually crack the tooth in and of itself. Put too much pressure on the walls of the filling, and you may lose this tooth or need a crown or a root canal or something like that at the very least. So that's a downside of potentially getting this type of filling. And if anything ever happened to it, you'd have to completely do the whole filling again. So it's not something that you can adjust or edit like composite filling. So if your composite filling chipped and you just had it done, a dentist can just go add a little bit more composite and call it a day, assuming there's no infection under it. So that makes it seem like composite fillings are just better in every way. However, they're not better in every single way. Or one of the downsides about composite fillings, these tooth color fillings, is that they are very, very moisture sensitive. So you can imagine what type of difficulty in certain times or certain positions this may create in an oral environment in the mouth. You have saliva going on. Some people have really inflamed gums, so they're bleeding out their mouth a lot. All of these things that are happening, people's tongues are swirling all around in the mouth. And so the dentist is trying to hold it over here and pull your cheek out of the way, but then I'm like, you're hurting me. The point is, it's very difficult to create isolation, which is like zero moisture environment in certain aspects. So in those environments, composite fillings are very difficult to put in there and last, because if any moisture comes there, the filling may come off. Amalgam does not have that same type of chemical binding process, so moisture doesn't hurt the process as bad. And they're also usually weaker and don't typically last as long. Now they can. You can have a composite filling last your whole lifetime, the same as an amalgam filling, just on average. You just don't tend to see that because they're just a little weaker in nature as a material itself. Now, that's the two differences of materials. When you go into there, what should you expect when I'm getting a filling? Now, what to expect when you go in for a filling appointment? Now, if you're going in for a filling appointment, I wouldn't be too nervous. The part of the procedure most people are most nervous about in the filling is the injection part of things, because no one likes needles. Very few people like needles that I've run into. But usually I would just ease your mind by saying this usually is a process that is very short in time, and it makes the rest of the procedure very, very comforting. Again, I know that won't make everyone happy. Hey, if you need some more anti-anxiety type of protocols for you, that's fine. You should also let your dentist know that. But just know that you're getting a very conservative, very mild, mundane procedure. It's not something super invasive, so I wouldn't be too worried about it. The sounds and things like that can throw people off, so you may want to bring headphones or a blanket or something comforting for you, so that you're not really locked into the noise and all the distracting things that make this type of thing scary, so to speak. That's usually what I recommend. Get a good night's sleep. Make sure you're not super hungry, so you're not agitated. Just make yourself comfortable and just try to relax for an hour or two, and that should be pretty much good. So the dentist, after they hopefully get you nice and comfortable and then get you nice and numb, what they would do is simply remove the infected part of the tooth containing the bacteria and all of their infected remnants, clean that out, and then begin isolating the tooth, depending on if it's a cavity on the side of a tooth or if it's a cavity on the top of the tooth. Again, just systematically filling that to try to recreate function. Now, when they try to recreate this function at the very end, again, we are not God or the universe or whatever it is you believe in. So there is some natural discrepancy that may happen right after the filling is made. Again, this is very technique sensitive. Each dentist is going to do their own thing, but the result usually can standardize pretty quickly if you have someone experienced and knows what they're doing, which is most dentists when it comes to something simple like this. And again, after that discrepancy is met, when the procedure is finished, you want to make sure that you report any type of sensitivities. Now, if you have just a very, very, very mild sensitivity, up to 4 to 6 weeks, that can be normal when you have something like a dental filling procedure done. Clearly, because you're irritating an area which has a connection to a nervous system, you may feel a very mild sensitivity. If you feel anything severe or more prolonged than 4 to 6 weeks, you should definitely make sure you report that to your dentist at any point in time. Now, what are some things you can do to reduce the side effects? 1, make sure you properly report and assess your bite. So after the procedure's over, usually dentists will make you bite on some little paper, you know what I'm saying, tap your teeth and all this type of stuff. Make sure you accurately report as best as possible, and even after. So when they're telling you to tap, if you feel it's off, just let them know it's off. Don't be the patient in the chair for 2 hours, but you kind of want to let them know what's going on. You don't want to leave and constantly bite on something unevenly, and that can cause exacerbated symptoms. Most dentists would rather just address that right then and there in the chair for 5 minutes than have you go bite on your tooth high for weeks and weeks or months at a time. Wait until you're completely unnumbed to start chewing. Now, if you have one of these white fillings, usually they're pretty set once you leave, so it's not really as far as breaking the filling goes. However, you don't want to bite your tongue or anything crazy like that, or if they had a silver filling or you're unsure, sometimes those do take a little bit more time. to kind of set into place. Avoid destructive chewing on the side of the filling. What I mean by destructive chewing is crunching super hard onto peanuts, at least until you can properly assess and report how your bite is actually feeling. Because sometimes when you're numb, you think you're reporting it the most accurate that you can. It's not your fault, but because you can't feel every side or it's not feeling the most even, some people have trouble accurately reporting. So you may want to wait a couple of days for that reason, also to engage in any type of destructive type of chewing behaviors. And before that, if you do have your bite feel uneven after your tooth wakes up, just simply go to the dental office, call them again and say, hey, I would like to come in for a quick bite adjustment appointment. That helps a lot. If you have any bleeding during the procedure, that's fine. Some people have inflamed gums. Now, having inflamed gums isn't fine, it's just normal, but having the result of bleeding via inflamed gums is very fine. If you have something like that, your dentist may tell you to use warm saltwater rinses for a week or two after. Look, you can do that even on your own, even though they don't recommend it. There's no downside to a warm saltwater rinses. Gargling with that twice a day, that really helps soothe the gums and help for them to heal a little bit better, creating a nice healthy environment for them. But it should be a very short and sweet appointment. You're just coming to remove the infected tooth structure, replace it with something that is not infected, and try to recreate the function of the tooth in the best we can to do that. And the more correspondence we can get from the patient and responsiveness we can get from you, the better usually that turns out for you long term. There's some other things that may influence how long your filling lasts. Between your own oral hygiene is probably the number one thing. Orthodontically, are your teeth in the best position? If they're in an inappropriate position respective to that filling or restoration will constantly fail. Have you had your teeth cleaned? Is that inflammation in the gums and bone area stable enough to the foundation of the tooth, or the housing of the tooth is stable in and of itself? Because no matter how well of a filling you do, if the foundation itself is not stable because of it's so inflamed in the surrounding area, then again, the tooth itself will fail, regardless of how well the filling succeeds. And so my last little 2 cents, when you see people with those little black things in the back of their mouth when they're opening, and people are like, they pointing back there and they're like, that person has a bunch of cavities. Well, not necessarily. It may signify that once upon a time they did, but right now their mouth can be very clean. So you can't really diagnose a cavity by seeing it, even though these fillings can develop cavities under them if they're not properly taken care of, just like anything else. It can just develop just like it did the first time. But yeah, that's it for the video. I didn't want to keep this one long. My last video was in under 30 minutes. I tried to make this one under 15 minutes, for attention span purposes. So I didn't go into as much detail, but you let me know what you think. Like, comment, subscribe. Again, it really helps a lot. I'm a small channel just trying to grow here, educate the public about oral health, oral hygiene, and everything in between. And again, my name is The Tooth God, and yeah.